And we are live. It's Dr. Justin Marchegiani here in the house with Dr. Alex Nelson, who is a functional neurologist. We're going to be diving into functional neurology, how to build a healthy brain. If your brain is not functioning optimally, you have brain fog, cognitive issues, neurological issues, brain inflammation, whatever that spectrum of symptoms is, we're going to talk about getting to the root cause. Again, Dr. Alex is a functional neurologist in the Kansas City, Lee Summit area. His website we'll put down below. Dr. Alex, what's your website?
hmlfunctionalcare.com.
Be right in the description below. So Dr. Alex sees patient in person as well as worldwide, like I do on the functional medicine side. So we're going to dive into these root cause topics today. Dr. Alex, how are we doing, man?
Awesome. Thank you for having me. I'm excited.
Awesome. Well, very cool. So I know you started off as a chiropractor like I did as well. And you decided to get continuing education, Carrick, IAFNR, a lot of these different functional neurological groups. I know you had a lot of education in nutrition and functional medicine. Tell me, how did you come from just, the chiropractic education and then moving deeper into more of these functional neurological fields? And what caused you, what motivated you to take thousands of extra hours of education and courses?
Well, first off, going to be fully transparent, and it starts with this was God for sure. When I was in school, I heard the word neurology, and I literally walked into the functional neurology club not knowing where I was going. So as esoteric as that sounds, then when I was going through school, I started taking courses, and I knew I was going to do neurology, and then I started hearing kids. And I learned mainly from my main academic mentor, Dr. Robert Malello. And our main focus is kids and kids with developmental disorders, everything from learning disorders, ADHD, autism, other sensory processing disorders as well. And we do work with adults. After we started working with kids, what happened was the kids would start to get a little better, or they get better, substantially better, and then the parents would shove them aside and say, "Now it's my turn." So we do work with adults, but primarily kids.
Excellent. And when we look at functional neurological issues with kids and we look at the treatments, I always like to look at compare and contrast, right? Conventional medicine has a handful of tools in their tool belt. And I'm just kind of making a list as you're talking here. But you have SSRI medication, you have stimulants to overstimulate to help with focus. These are your Ritalin, your amphetamines. You have your typical, like you see it more with kind of autism, but your antipsychotics like your Risperidol or your Abilify. You have things that work more on GABA and your benzodiazepines, whether it's Klonopin, et cetera. You have your anticonvulsants. And then you have your different layers of behavioral therapy, whether it's cognitive or speech or occupational. And that's kind of it. I mean, there isn't a lot in between there. Is that a pretty good summary of what conventional medicine has to offer across the board there?
Yeah, it's a silly analogy, but this comes from Dr. James Chestnut. When it comes to Western medicine and particularly in neurology, they're really good at being a firefighter. If your house burns down, i.e. your health or your brain, and you need something emergency to get you out of fix, Western medicine's awesome at that. But don't call them to rebuild your house. You need contractors. You need Dr. Justin. You need me. You need other like-minded practitioners, because we have the hammers and we have the nails. They have the axes and the fire hoses. And you're absolutely right. It's just limited with what they do because that's their training. There's nothing wrong with it. It's just that we have to have our side of the coin, or our training, to be able to help these people with these chronic health problems.
And I see patients that are so needing a diagnosis, like I need a diagnosis. But the problem with a lot of diagnoses, a diagnosis mostly is there so a doctor can get paid from an insurance company and recommend a medication or a surgical procedure. But most of the time, that diagnosis does not go upstream and connect to the root cause. Diagnosis, if I had a broken arm, is very helpful because I can apply a surgery and a procedure that's going to fix that. The underlying cause does not have to be addressed because it was an isolated one-off. It was a car accident. That car accident only happened once. Ideally, it won't happen again. It's not an issue. The problem with what we're dealing with is we're having kids and adults with little mini car accidents every day, every second. And so if I just palliatively treat the brain, or if I overly stimulate with a methamphetamine, well, most of these kids are already stressed and inflamed. Their brainstem, their amygdala, that fight or flight response in the back of their brainstem is already in overdrive. So putting it more in overdrive does nothing to fix the underlying issue. And so when you look at root cause on one side, palliative on the other side, you can see a lot of times it may help in the short run, but in the long run, it actually makes the problem worse.
Yes. Yes, and probably the best example of that, which is on the rise with adults, is the diagnosis of ADHD. It seems like more and more adults I talk to, they're going into their therapists and or professionals and they're getting diagnosed. And the kicker with this is they're getting medicated. And the problem is going to be, and I kind of put reminders in my phone when I run into these people because the problem is going to be in about a year, the symptoms are going to get worse. Your child's, if you go back to your child, if your child gets diagnosed, it's almost clockwork. What's going to happen is they're going to get diagnosed, they're going to get medication. Schoolwork might improve over that year, but then after that next year to 18 months, it's going to go back down. It's going to get worse. And then you're going to be on the medical merry-go-round, is most of the situations.
And the issue is if we had patients, we had young kids or even adults that had unlimited amounts of these medications, they're getting treated, they're on every single one of these, you're not fixing the underlying issue because obviously the people that you're seeing have already gone down this path for many years and they're not happy. They see the symptoms getting worse over time. So, obviously the solution isn't an unlimited amount of these medications being thrown at them. I mean, I imagine you're seeing patients that have already gone down this route. What's their general experience? Like, is it like, Dr. Alex, I've gone down this route and I'm exhausted, it's not working? Or have they not even gone down that route, but they want to go down your path first? What's that patient look like?
Unfortunately, it's probably like a lot of your patients. I
Yeah.
assume, and that's unfortunately people have already been down the medical route. They didn't get where they wanted to get, or in some cases they got worse, and they kind of woke up one day, or they finally maybe listened to a loved one or something, and that parent or that person came in and they're like, I am ready to listen to what you have to say and do what you have to offer because I now understand that what I was doing before was just putting a band-aid on it. And I want to see what we can do to get down to the root cause as much as possible. And that's it would be so much easier to have those people come in early on, but unfortunately, with how people are getting educated online or just with how the pharmaceutical industry will put massive amounts of marketing and advertising out, people are going towards the medical route. However, maybe you've experienced this, and something I've noted is in the time of COVID, you can almost say people got a little quote red pilled, and
Yep.
we have more and more people coming in, and I do not mean this in a braggadocious way. I do not want to come off arrogant at all, but more and more people are wanting my wife, who I practice with, her
Yep.
and I, to act as their primary care because they want to listen to what we have to say first. Now, does that mean that we act like a primary care and we give meds and all that? No. In fact, we still say you need to go to your primary care because there's things that they do and check for that we're not going to and we don't have the training to. But they will come back to us and they'll say, they're recommending this. What do you recommend? And they're listening to what we have to say first and considering what we have to say first. And that's very encouraging.
Well, I think a lot of this just started with a massive distrust from conventional medical authorities during COVID. I think people just saying, "Hey, let's just shut down the schools. Let's just stay inside. Let's not get vitamin D. Let's not get fresh air." And I think we looked at the devastation a year or two later. I mean, we have kids that are years behind that they may never get back to that literacy rate or that progression rate that they were at in school and learning. And then a lot of these kids needed to be with teachers. That's the only way that they can discover abuse and all kinds of things that are not happening right at home. And I think that all stem from people in the public health and medical institutions not making good decisions, and that broke trust. Also, there's a book out there by Cassie and Callie Means, or Casey Means, and she's a former Stanford doctor. It's called Good Energy. But in that book, there's a couple of stats, and the average child, or 13-year-old and less, 70% of their diet's processed food, and the average doctor has no education in nutrition at all. I mean, even at Stanford, zero, very little. Or if they know about it, it's from a disease perspective, right? oh, beriberi B1 deficiency, or scurvy is vitamin C. They don't know it from a functional nutritional perspective. And so it's very difficult to build healthy brains and bodies and metabolisms when 70% of your diet is processed crap and the average medical doctor has no education in it.
Yeah. Yeah, and I'll still hear people come in and we'll have a child with health issues, immune system dysregulation. It could be ADHD. It can be just name it. And they'll come in and unfortunately they'll say, well, the pediatrician says that diet doesn't matter. And then you start talking about, okay, why would they say that? And sometimes that's purely just that's not in their training because their job is to see a problem, diagnose, and then treat. And the treatment is usually medication. So if it's outside of that realm, that's out of their black and white. Everything else is gray, it's unknown, or it is unapplicable. And that's pretty much the mindset of a medical doctor. And that's why some people are getting turned off by that and they're seeking other means to get their health needs if they can't figure it out on their own.
100%. And I don't think it's, any big conspiracy, like your doctor has all this information and is withholding it from you. And there's like,
Yeah.
I picture like a guy with a top hat and a monocle in a smoke filled room, right? With cigars. Like it's not that, right?
No.
Corrupt. I think it just comes down to the average doctor lives 10 years less than the average patient. So it's not like these doctors have all this information and they're just withholding it from you. Their education is drugs and surgery. They're primarily founded by big food, big agri, and big pharma, right?
Yep.
And then if you go look at how that happened, I mean, you can go back to the Abraham Flexner Report, 1910, paid for by the Carnegie Endowment, that took medical schools in the direction of pharmaceutical and surgical care, moving away from chiropractic, naturopath, homeopathy. That's kind of where we had a much more broader medical institution 100 years ago, and it's gotten way more specialized. And it started there. And if you go read Good Energy, they kind of talk about where that started and how it's gotten to be where it is. And so then the average doctor, their curriculum and their education is this. But the problem is there's a lot of hubris and arrogance behind it, that if that doctor thinks, hey, if it was important, I would have been taught it at Harvard or Stanford. The problem is it's not true,
Yeah.
right? Because the powers to be and what created that curriculum for you put that information in this track here. But all of this stuff that we're talking about, nutrition wise, functional neurology wise, is over here.
Yeah.
And so I think that's really the difference, is just that the curriculum is very limited. I mean, for instance, the American Diabetic Association makes no specific recommendations of carbohydrates and sugar in diet to diabetics when we know diabetes is a disease of high blood sugar. I mean, that's
not
kind of
amazing?
where we're at with nutrition.
It's
It's crazy.
unbelievable. Yeah.
Unbelievable.
Unbelievable. I tell my patients that all the time. And there is a neuropathy clinic 2 doors down from us. And it is a tragedy seeing these people try to even walk. And there's nothing changing with their health. It's mind blowing. Absolutely mind blowing.
So I brought both my kids to see you, and I know you did a very, very specific kind of unique workup. I like to always compare and contrast, right? Someone goes to see their pediatrician or they go to see a neurologist, right? They're a mom or a dad that has a kid who's 5 or 6 or 7. They know there's some brain issues, some learning issues. Just kind of compare and contrast for a few minutes. What does your assessment look like? And then compare it to the general pediatrician or pediatric neurologist workup.
So, to be as brief as I can, it usually starts with consultation. We want to get the parents on the phone or
Yep.
in the office. If the child comes too, that's great. Get to know them just like we did with you guys. Then make sure it's a fit. We want to make sure parents are comfortable, make sure we're comfortable, make sure we think we can help you. Then after that, we send you home with a chunk of paperwork and get to know the child on paper. And then as long as everything lines up and there's no what's called contradictions to care, then we're going to have you come in for the exam. The exam can be anywhere from it can be more, 1 hour, 2 hours, 3 hours. Today I did, took me 2 hours to get through an exam on this 18-year-old girl with autism. And when they come in for the exam, development, it's going to be more development related. So I'm going to be looking at what's called retained primitive reflexes. If those are present, then the next stage of development, core strength, gross motor skills, and in general muscle tone is going to be down. It's going to be low. We're going to have issues. If that's going to have issues, then the next thing that needs to develop, which is generally speaking sensory processing, including your vestibular system, which is your brain's awareness where your head is in space, your proprioceptive system, your brain's awareness where your body is in space, and your vagal system, which is your brain's awareness of what's going on inside and amongst other things, then that's going to have issues. Then the next thing is fine motor skills, then and ocular motor control included in that. Then on top of all that, we have at the top of a tree, if you will, is going to be our cognitive, social, emotional, and physical traits. And we all want to see those four big topics in our kids be great. We want them to be socially with it. We want them to be emotionally with it as well. We want them to be Patrick Mahomes. Physically, we want them to also just be great humans. And if that's not enough to ask, if you have all of that stuff going on under the hood, then we're going to have problems. So depending on the child, Dr. Lauren and I will assess, depending on the age, it could take 50 points of data and observation up to 300 or more. And it takes hours. And then we go over the results and lay it out. And as long as it makes sense and everyone wants to move forward, then we start going to a brain-based functional neurological program where we're working on the underlying areas of the brain that aren't working as well as they could.
So essentially, you have these refluxes in kids and in adults too, but you see it more in kids as they mature, as their brain develops. These reflexes drop, right? So
Mhm.
you're assessing whether these reflexes are apparent, and then you're also doing tests to look at the function of the nervous system. Correct.
Yep, absolutely.
So
And
what are just people listening? What are some of the just your top three tests that you look at to really get a window to how that nervous system's working?
Uh, probably my favorite are the primitive reflexes. So the big one is if that child has a retained Moreau reflex, that's the baby startle reflex. If
Okay.
that's present, we're gonna have heightened
Mhm.
sympathetic nervous system activity. I like to look
Yep.
at the vagal system. If that vagal tone is low, we're gonna have digestive issues, immune system issues. We're gonna have social and emotional issues. That person is not going to be healthy by a lot of means. Then I like to look at eye function. I use both bedside and a system called Right Eye, where it's really cool. It's a computer with cameras at the bottom that watch how well the eyes move. So the kids and the adults stand in front of the computer and they just move their eyes and they're like, "Oh my gosh, this sees how my eyes are moving," and it's great. And it measures down to the micrometer how your eyes are moving. The eyes are a window into the brain, and that tells me a lot of information.
That's very cool. Now, when you're looking at the brain, right, there's different parts of the brain. We have, our cerebrum up top, and especially the frontal cortex, which is higher learning, problem solving, predicting outcome of actions, right, behavioral stuff.
Mhm.
And then we have the cerebellum in the back here, that big bump on the back. That's going to be more balance. It's going to feed into the cortex, but it's mainly on balance side of the fence. And then we have our brain stem in the back, which is going to have, medulla pons, midbrain, which is going to have a lot more of the, blood pressure, breathing, respiration, but a lot more of that kind of amygdala fight or flight response. Is that correct?
Yep. Yep.
And so when
And those
you're looking at a patient, are you looking at these different imbalances in these different parts of the brain? Just can you go a little?
Yes. So I'm looking at all of that, and the brain develops from the bottom up, and I typically start the exam from the medulla, which is the lowest part of that brain stem, up to the pons, and then you said the midbrain, go into the limbic system. The cerebellum is huge. The
Mhm.
cerebellum, there's more neurons in that cerebellum than there is in your cortex, and the cerebellum
Really?
yeah. The cerebellum is the master coordinator of the brain. It coordinates our motor function and our balance, but it coordinates our thoughts and it coordinates our emotions. So go to sleep thinking about that tonight. Uh, and then we go into the separate lobes of the brain, the occipital lobe, temporal lobe, parietal lobe, and of course the frontal lobes. And then we like to divide that out left and right and make sure we're having, uh, we're looking at the functions of all of that. And that's done with general core strength exercises, balance exercises, sensory integration checking, looking at how the eyes are moving. 5 major areas in the brain control how the eyes move. That's a great window into the brain again. Lots of checklists because some of these things are cognitive and academic tasking or logic and reasoning tasking. There's a lot of questionnaires and tasks and uh, uh, questionnaires and just standardized checklists that we use to look at this general function, and that gives us a great window in. It's functional neurology is what I call the clinical application of neuropsychology, because a neuropsych
Mhm.
will take the neurology and then apply it to try to help them psychologically. That's what func neuro is. Whether we're working on a brain that's
Yeah.
demented or ADHD, we're looking at the areas that aren't working as they should because we know what's normal, and then we're usually going after the areas that are under functioning. You can go after the higher functioning areas, but
Mhm.
that's another topic.
Yeah. So when we look at this, functional medicine kind of, I think, dovetails perfectly with functional neurology.
Oh
Because
yeah,
we look at most neurologist tools, right? It's going to be mostly drugs. Very, very little on the surgery side, unless there's like some kind of an acute bleed. Then you're going to a neurosurgeon, right? But for the most part, it's going to be medication. Where we're looking at the cortex, we're looking at the hemisphere, we're looking at the different parts of the brain and how they manifest symptomatically with movements or functional testing. And then you're providing stimulus to bring some of those parts of the brain up. Can you just give me a couple of examples? Obviously, it's going to be specific. So if you're listening at home, like what are a couple of symptoms that you would see maybe with the cortex hemisphericity or a cerebellum? And what would be a couple of simple movements that could be done to bring one side up over the other?
going back to the vagus nerve, that's probably the biggest one. So can't
Okay.
not, you can get a little hemispheric with working with that vagus nerve, but simple breathing techniques is going to activate that vagus nerve.
Mm-hmm.
Applying heat on your abdomen will activate that vagus nerve. The vagus nerve controls all those organs down there, including digestion. And if you can tap into the physical attributes of that vagus nerve, that information is going to go in and talk to the corresponding areas that will eventually relay information up to the cortex that deal with social and emotional understanding. So, like in office, for example, we have this device. We put a electrical pad on the person, like maybe on their left hand, or I might put on their left leg, and then we will put a probe on their left ear, and particularly on their Simba concha. And then we turn the probe on, and it's sending a little electrical signal in, and that's talking to the vagus nerve. And what's interesting is if I put it on their left hand and then I bring on some vibratory tactile input on the rest of their left body, then that information is going to activate their right brain. And then their vagus nerve is getting activated at the same time. I might also use one of our cold lasers from Shed Light, where I'll be shining light on their brain at the same time. I could also be running specific tones at the same time to get more hemispheric input into the brain to activate maybe the left or right side. So if I want to activate that right side more, I'm going to bring more sound in on the left side because 60% of your auditory input crosses over. Um,
Mm-hmm.
that's probably one of the best examples, and that's what we do quite a bit of because uh, the rates of anxieties and depressions are up, and that is a pretty big function that is contributed by a lack of vagal tone input.
In the vagus nerve, essentially, it's a cranial nerve number 10, right? And vagus literally translates to the wanderer. So it wanders from the brain all the way down to the organs, and it hits that parasympathetic. That's kind of rest and relax, right? And so when we go parasympathetic, that takes us away from that brainstem amygdala kind of fight or flight response that's more sympathetic. Is that right?
Correct. Correct. Yep.
What else can we do that activates the parasympathetic in alignment with that vagus nerve?
So outside of breathing techniques, and there's simple breathing techniques like box breathing. People can look up box breathing. There's great tutorials online. You can look up 1 to 2 ratio breathing. So the amount of time you take breathing in, double it breathing out. Breathing in is a
Mm-hmm.
sympathetic nervous system activity. Breathing out is a parasympathetic nervous system activity. It's why when you are panicked or worked up, it's a good idea to breathe in, but breathe out very slowly because it's going to activate the parasympathetics. Um, the other next best thing outside of, if we can go into nutritional means, is exercise. There's nothing that metabolizes cortisol better than actually sleep and exercise. If we can have the person move and get their heart rate up, there is no better prescription on the planet for getting that vagus nerve, that vagal system, to not necessarily directly engage, but secondarily engage because the frontal lobes are going to kick in more. We're going to have more endorphins. We're going to have better top down approach to that vagus nerve.
100%. One of the things I do with my patients, I do functional glucose tolerance testing. So we'll get a really good blood sugar meter. I like the Keto Mojo because it's got a Bluetooth link, so you can graph it to your cell phone. You can see the graph on it. So we'll do a before we eat test, and then we'll do a 1, 2 hour, 3 hour, and we can see how our blood sugar goes in that first couple of hours, because that first hour or two is where we dump most of our insulin.
Sure.
And most people, they literally live their life on a blood sugar roller coaster. And when you spike up really high, you make a lot of insulin, your beta cells, the pancreas go crazy. And then a lot of times, if you're not fully insulin resistant or diabetic yet, now you have this reactive hypoglycemic drop, and then now your blood sugar goes to the floor, and now you're making lots of adrenaline and cortisol to pick up your blood sugar. And so
Sure.
when you do that, that creates more of this fight or flight sympathetic response. And when people say, how does exercise help with cortisol? Well, what happens is when you spike cortisol, you actually are mobilizing a bunch of glucose, because prehistorically, stress and cortisol meant I needed to run or fight something, and I needed instantaneous fuel for my arms and legs to use. The problem is when we're stressed at our computer or at our car, that glucose is like we just ate a freaking candy bar and now we're not using it. And so by getting some movement, even a simple 5 or 10 minute walk, that clears out the glucose from the cortisol, which then prevents that insulin resistance, inflammation kind of pathway from happening. Thoughts on that?
Yes. So I couldn't have said it any better. The one thing that comes to mind, if people don't already know this, because if we don't need to go into controversy by all means, but if autism does not bankrupt our country, then or dementia will. And
Yes.
in the world of research when it comes to dementia, and the most common form of that is Alzheimer's. In the world of research, it's called type 3 diabetes. Whenever it comes to a brain that is falling to dementia or degenerating, whether it's subclinical or clinical, there is always, always, always a blood sugar component. And there's always within that same system is the stress handling system. It's not going to be up to snuff to handle it. For people that are concerned about having a brain that might not be up to par one day, or you're concerned about your loved ones, it is keeping your blood sugar in a healthy range is number one. That is always what we go after before we even talk about working on your brain and having you come in the office and do fun brain exercises. I'm like, well, we got to go over what you're putting in your mouth and how much of it, because all of that work doesn't matter.
100%. I'm going to pull up a tab here. This is really important. So Blue Cross did a study, right? This is an in-house study with all the people that are Blue Cross insurance members.
Oh, wow.
And this came out right at the time of COVID, right? So this is like February 27, 2020. So you can go back in time to what was going on then. But this is crazy. So this is people that have Blue Cross. Check out these numbers. The numbers of diagnosed people with Alzheimer's and dementia in the 30 to 44 age group went up 373%.
What?
And among 45, yes, so 373% between 30-year-old to 44-year-old adults. This is crazy, right? And when you go back, and I'm a mechanism guy, right? I know you are too in functional neurology world. But if you just go type in something called insulin degrading enzyme, okay? Insulin degrading enzyme is an enzyme that breaks down and metabolizes insulin. It's in the brain. It's active in the brain. The problem with that enzyme is also responsible for clearing out inflammation and plaque in the brain. The problem is you only have so much of it. So imagine someone spills a bunch of water on the floor, right? You go to mop that water up, right? Let's call that water glucose and insulin. And let's say someone spills another bit of liquid, and that is more inflammation and plaque. The problem is that mop is already saturated. It can't clear up the other mess in the brain. So this is a sign that our brains are overloaded, and part of it has to do with, like you said, type 3 diabetes. And then you get in the nitty gritty. It's the insulin degrading enzyme that is the issue that's being stressed there. Thoughts?
Whoa. So I'm kind of speechless. I did not know this stat.
Isn't that
So
crazy?
gosh. So this,
I'll put it in the chat too. I'll put it in the chat, people listening.
oh my gosh. So of course that's a relative stat. So I'd like to know what the numbers are. Like how many adults that are in my age group, your age group, are walking around with dementia?
Yes. This is from the Blue Cross Blue Shield website. This is not like some, BuzzFeed article, right? This is internal studies from their own from their own Blue Cross Blue Shield people, which, is in the millions of people.
Okay, because I joke and I say this tongue in cheek, but after COVID, I started questioning people's frontal lobes, especially on the road driving. I'm like, oh, this is someone who's not doing good here. It's just based on the behavior of the car, right?
Right, right, right.
This completely validates it. But this goes hand in hand. This goes hand in hand with things like um, simply trying intermittent fasting and what that can do to
Yep.
clean out the brain. It is uh,
Yeah.
that I am unapologetically Christian. So whether you believe we've been on the planet 6 million years,
Hmm.
billion years, or six
Hmm.
thousand, the thing is we are meant to go a long time without food, a long time, regardless.
Hmm. Hmm.
And our brains and our bodies are really good at actually detoxifying and cleansing itself by not eating food. And that's why intermittent fasting is such a almost like a fad now. People are like,
Hmm.
"Oh, I'm doing fasting." I'm like, "Yeah, you've been doing it for 10 years. Like, you're not exactly supposed to do it, all the time, every day." But
Right.
that that brings up the point of fasting and not chronically overloading your system with food and what those.
So here's the thing. Go ahead.
Oh, no, go ahead.
So it's been said out there that they're trying to pass Ozempic for obese children, right?
Oh,
Under 13 years old as a first line therapy. Just give me your knee jerk reaction. Ozempic before any diet change. Go ahead.
uh, the first unfortunate thing that comes to mind is cancer.
Hmm.
And that's because
Why's that?
well, these medications, they are rough on the pancreas and the liver. So
Hmm.
these
Hmm.
drugs that are being used for type 2 diabetes, and then now people are using them for weight loss. What they're not talking about is the risk of pancreatic and liver cancers go up.
Hmm.
Um, as a first line therapy, I don't see that kid necessarily getting off the medication then. Especially
Correct.
through hormonal changes at being 13, 14, 15 years of age, and I'm not sure what that's gonna do to their, HPA access, to be honest with you.
I agree. I mean, I always look at the mechanism of the drug, right? So mechanism one, right? Glucagon like peptide one. So it's
Yep,
it's basically increasing glucose production when glucose goes up, but it's decreasing it overall. Two,
yep,
it's paralyzing the stomach in a way. So food sits longer in the stomach. So it creates a satiation signal. So essentially, what you're doing is you're manipulating the satiation signal in the brain. So now you're more in control of your appetite. But the problem is, you still have to have education about eating the right foods. Because if you're still eating processed food, then that's a problem. Because now you're eating less food. So now if the food's still processed, now we got a big problem of nutritional deficiencies, right? And number two, what does that do to digestion? How does that impact absorption of other nutrients? I mean, we saw it with like metformin cause all kinds of methylation B vitamin issues. And we know that it hits the addiction center of the brain where now you may not get any pleasure out of eating. And so now, do you eat enough? We know there's all kinds of muscle wasting data on people with taking Ozempic because they don't eat enough protein. And so now their
mhm.
muscle starts to waste. And so now it's like you literally have to force food. Imagine like after a Thanksgiving Day dinner, like someone forcing more food in you. That's what eating most of the time is like on those medications.
Yeah, and now you're doing that to a teenager who is naturally, let's just say they're neurotypical, quote,
Yeah.
uh, they're already going through a stage in their life where they're going to be obstinate. So then they're supposed to
Right.
grow. They're supposed to nourish their bodies quite a bit more than an adult. And now you're gonna there's so much in my mind now. Now and talk about the females who, have a heavy have it heavy on their hearts on how they look. And we have these females who are you gonna try to convince a female who lost weight with taking this drug to eat? Because they finally look decent? They're not gonna eat. And now we're gonna end up having, brain-based, just in my world, brain-based nutritional deficiency problems. We're gonna like you said, they're not gonna eat protein. We'll end up having I don't are we gonna end up having people with true beriberi walk around? Because,
Right. And
uh,
also, yeah.
I or
Also, too, if it's go ahead, go ahead.
well, or I'm just thinking just like actual old school beriberi, scurvy, where people are
B one.
not getting nutrients because they're simply not eating. Oh gosh, I
I
didn't
agree, and also if we're I know it's crazy. I mean, also if we're impacting the part of the brain that allows pleasure from food, and then we're also seeing we're seeing it now being used for addiction because it cuts off that addiction. But I mean, you would know better than me, but I mean, those areas are probably pretty close to the areas of the brain that allow you to feel pleasure being with your spouse, doing a hobby, being with your kids. I imagine those pleasure centers are pretty close, and you'd probably see other apathy and other mood and depression related issues, maybe as a side effect of these medications.
Yes. Yeah. Addiction is addiction is addiction. It doesn't matter if you're getting your pleasure from your technology or sex, drugs, rock and roll. But then if you are
Right?
not getting pleasure from things, then yeah, apathy is going down. I wonder what these drugs do to dopamine in the long run. Then what is that going to do to dopamine production, metabolism, levels in general? That is very concerning. So then now you have a teenager who doesn't want to eat. They're going to be even more apathetic. I mean, good luck seeing them come out of their room if they have a phone in their hand,
Totally.
let alone being on this drug. I did not know they're doing this. I know that they're pushing for this drug to be used a lot, and there's a lot going on behind the scenes to get it marketed and really get it pushed. It's going to be coming. A lot of people are going to see these ads more, but not on kids. That's holy cow.
Yeah. And my general recommendation is if you're 400 pounds, 400 pounds overweight, and you don't ever get full, that satiation signal is broken due to constant insulin resistance and hyper stimulating, hyper palatable dopamine foods. Maybe that makes sense for a period of time. My general recommendation, if you use it, chart your food, make sure you're getting enough protein, 1 pound per pound of body weight, and make sure you chart your micronutrients. Make sure they're all checking off. Use an app like Chronometer. Make sure your micros and macros make sense. But always try to get to the root cause. I think going the functional neurology, functional medicine way, there's so many other tools we have in our tool belt, nutritionally, nutrient wise, exercise wise, hormone wise, that I think may be a better approach. And also, what if you're hypoadrenal, hypothyroid, and then you're going that? Well, there's so many other systems that are broken that I consider are higher up that need to be worked on first.
Yeah. Oh my gosh. Holy cow. Yeah, that is mind blowing. Now I got to put that on my list and go down this rabbit hole and see when this is coming because this is scary. Not good.
And so we can imagine like these 30 to 44-year olds in this Blue Cross Blue Shield study they're being diagnosed, right? We know that diagnosis has probably been coming for 10, 20 years. So now are we starting to see the first signs, the first step in the direction of Alzheimer's and dementia with 6, 7, 8, 9, 10-year olds? I'm going to guess it's starting there. At least it's got to start somewhere, right?
Gosh. I mean, I don't want to say even early as in their third or fourth decade of life, but oh my gosh. Uh, there certainly could be some with the right, I'll say, recipe. In the teen years, I could see signs of that occurring with the quote right medications like a GLP-1
Yeah.
and antipsychotic, and the continued just abuse of their whether they know it or not, abuse of their body with diet and exercise and just improper sleep hygiene, all of that. I could see that. I could 100% see that.
So, what do you see on your functional neurological assessments? I mean, obviously, you may do a diet diary, you may talk about nutrition and just glean it from that and from their daily routine. But what are you seeing from a manifestation physically in your testing
The biggest thing.
when these issues are present?
Oh yeah, the biggest thing with most of these situations is I'm working with primarily people with attention issues, sensory processing problems. Again, children on the spectrum. The thing is these people are out of shape, whether it's physically they're overweight, or
Hmm.
they just do not have strength. That is that is a very big ordeal. This is a bit of a bombshell, but to put it in perspective, if you have a nonverbal child, depending on how old they are, and again, this is not to be braggadocious, not to sound arrogant. This is not what this is supposed to be. But the muscle tone of a nonverbal kid is going to be very low. They're going to be a sack of potatoes. They're not going to be able to move their
Yep.
body well. Uh, the foundation to fine motor skills and your verbal skills are a fine motor skill. The foundation of fine motor skills is core strength and gross motor skills. So to get a child to talk that is nonverbal, we hound them and we kick their butts. Basically, we look like personal trainers and we get them to move their bodies. That is the ultra worst case scenario when you have a kid who's nonverbal. Otherwise, a lot of these kids, whether they're verbal or nonverbal, they're out of shape. So more and more of our program is being physically oriented, and then we're trying our best to have other practitioners. Like I need to just start sending families to you so you can see them on the nutritional needs because it's getting to be overwhelming, or other practitioners like you to take care of them nutritionally. And then our next office is going to basically have a whole it's almost going to look like a personal training studio and some part of it because of how much physical exercise these kiddos need.
So you said some things that really hit a chord. So you're talking about kids that are nonverbal, they need to move. So you're talking about fine motor skills. What are some examples of fine motor skill exercise?
Well, so with kiddos on the spectrum, for instance, they we always want them to learn how to use a pencil, draw. We want them to be able to button their shirt, try to dress themselves. We want them to be able to talk. We want them to verbalize. We are organisms that are meant to speak. And if they're not speaking, then there's obviously something wrong. But that is not necessarily a verbal problem. It is downstream or upstream, if you will, and it's going to be a gross motor or core strength problem. So sometimes these kiddos, you can get some of their other fine motor skills taken care of, but because verbal skills is uh, it is such a dominant task of the brain, if you will. It takes a lot of metabolic activity. You can get them to use their hands a little bit, but to get them to use their mouth, that takes a little bit more. And it's usually stemming from this core strength and gross motor skills problem.
And I imagine too, in your office, you're using a lot of laser technology. So you're doing probably some of these movements plus stimulating deeper parts of the brain at the same time. And you probably get better results doing that, right?
Yeah, and we hook them up on electrical equipment to do the strengthening for them, all sorts of things at the same time. Yep.
So it hits an accelerator. So you're giving parents exercises at home, but then you're doing things in the office that are kind of supercharging it.
Yes. Yep. It kind of more advanced forms of it involving technology.
So you kind of talked about patients that you see. You gave an example of like the nonverbal patient. What would that, again, not saying that particular patient, but that kind of patient in general, what would their kid's diet be like?
Most of the time, those kiddos are very picky. They have poor olfaction systems. That's part of what's going
Yep.
on with that brain disorder, and that is because their sensory systems are vary at what's called close to threshold. So if you're talking about a neuron, you got to follow me here, people. When it's at rest, it's down here. When it's ready to fire, it's up here.
Hmm.
Most of the time, they're
Hmm.
here, and it doesn't take much to overspill it. So if these kids often they walk in a room and they could smell delicious baked cookies and it's gross to them because it's too much input for their system and they're like that's disgusting and out the room they go. So that's why bland chicken nuggets and mac and cheese are good because it's carbohydrates, sugar for their adrenals, and
Sugar.
then it's
Yep. Right.
a gluten just baked into chicken that's been processed and it's gonna taste good. Um, so their diets are usually just that, maybe a couple other things, but not much past that.
And you see gluten is a problem, right? From an inflammation standpoint in the brain in your
Yeah,
office.
100%. If it's not it's inflammatory for the brain, one, and then most of the time people are sensitive to it too, and that it's a kind of a humdinger. And at least the gluten in our country, we're not really meant to eat it. At least not regularly, every day, 3 times a day. It's
Right.
not
Ex-
meant for our brains.
Exactly. Now, let's just kind of go over some parenting skills. So you got a kid who's really picky. How do you handle it? Like my natural approach is this is one, it's environment. Like the other crap is not around because if the kids can't see the other things, it's just a sense of this is all we got. Once there's that reservation of like there's nothing else hiding around the corner, okay, and then hunger kind of sits in, and then they're more open to eating healthier food. So my recommended take is environment number one, and number two, parents should be modeling the things that they want their kids to eat. They should be eating it, having that family dinner or family meal where they're eating the thing as well. Kind of creates that, hey, it's good for the goose, it's good for the gander. What's your take on that? And what else would you add to it? How forceful should you be outside of just saying, hey, well, if you don't want to eat it, then we'll just go hungry this meal. How do you handle it?
Well, it's not only that, but then I try to advocate for a lot of the ad rule. So, uh, you got the chicken nuggets and you got the mac and cheese over here, but you have to try this. And I'm not saying like,
Yes.
try your leaf of lettuce. Like, no, no, no. You're going to have this much. And children on the spectrum they need expectations. So you tell them exactly that. You say, you eat this right here. Then you can have that.
Yep.
Lay it
Yep.
out for them, and then even lay it out before you even have dinner. So expectations do well with these kids. You say, we're going to eat in 1 hour. 1 hour, you're going to have your chicken nuggets and mac and cheese. Before that, I'm going to have a little square on your plate, and you're going to eat all of that other food in that square. If you do not, then you don't, then you make your deal, whatever it is. You take something away of that food, and you can make that the award, if you will, or you simply just say point blank period, because they understand black and white. That's all their brains know, is you eat this before that or nothing. Eventually they'll get it. Some people are
Uh,
like, but my kid's going to starve. And I'm like, your kid's going to be okay for less than 24 hours without food. It's okay.
Exactly. Your kid's just trying to figure out how much they can get away with, and once they feel like there's no wiggle room, they'll do the right thing.
Yep.
In my family, it's very similar as well, right? So if, let's say, there's some berries or something that's more carbohydrate rich, that's cleaner, maybe some sweet potato fries and some avocado oil or a handful of fresh blueberries, those are put off to the side, and we're eating our protein, our fat, and maybe a no thank you bite of the vegetable first.
Yep.
And the no thank you bite isn't even about getting nutrition; it's about exposing that taste to the brain, so the brain can start to normalize that taste.
Sure.
And the biggest problem I have is, okay, you do it, but you piss and moan and whine the whole way
Yeah.
doing it. And my whole thing is, if you piss and moan and whine but do it, it's as if you didn't do it. And we have a small little table, and I move that table outside. I'm like, all right, I pick the table up. It's going to go out my patio. Now we close the door, and now you can eat out there. So if you're going to piss and moan, no one can hear you, right?
Yep.
Tree falls in the woods, no one hears it. It's like, did it happen? Sure, right? So that's
Yeah.
kind of my take. Obviously I had that more masculine energy. My wife's more nurturing about it, so we kind of balance each other out.
And it's harder with kids with needs, but a couple simple tactics can go a long way. It doesn't matter if your kid's neurotypical or if they have issues. It's a behavioral. There's going to be behavior driving it, and you don't. I'm saying it might sound rude as I say this, but you don't need a frontal lobe to train behavior. Behavior is if you can get a severely special needs child to have some basic function and behavior, that's not their frontal lobes doing that. That's other lower brain centers. It's the same for food. So 100% modeling, 100% setting expectations, and giving them even long-term expectations. You can even tell them in a week, we're going to start this. 4 days, 3, 2, 1. Today we're doing this. And that goes a long way, because you're introducing change in their life, and most of them don't do good with change. So setting the expectation is massive for these kids.
Yeah, and also if there's a processed food that your kids are eating that's not healthy, but let's say let's say this information is new for you and you're trying to make a change, a really good thing is take that food in the house and have your kid throw that food in the trash with you on trash day and say bye to it. Bye. That's it. Kids do the same thing with pacifiers, hook it up to a balloon. Bye, Passy. Same thing with food. And that way the kid can see that they're part of the change in environment. It's no longer going to be there, and they can see that.
Yeah, that's huge. I like
Yep.
that a lot. That's massive. I
Yep.
like that a
So
lot.
it's environment. It's framing. The framing thing out is so key, because so many parents, they're parenting kids like this in the moment,
Yeah.
and kids in the moment, once they get a surprise, their limbic system gets fired up, and it's going to take 20, 30 minutes to come down from that. So you're going to be dealing with an irrational kid all dinner long. So that the framing of expectations ahead of time is so crucial.
Yep. Yeah. It goes a long way. It's so important for these
So,
kids.
well, very good. Well, I know we're going to wrap up here in a few minutes, but what else are you seeing? Like, what are some other simple issues? Or I shouldn't say simple; it's all complicated. But maybe you have simple steps to address it. What are the big issues that you're seeing with parents that are coming into your office, and what are just like some simple strategies that people are missing? Like, too much carbohydrate, too much inflammatory food, not enough movement? Like, what are some simple things someone can listen to and start implementing today without being under the care of a doctor?
Technology. So
Mm-hmm.
there's we're all guilty of it, but technology is getting overused. So
Yep.
too many. I am not a parent of a child with special needs, so this is not a judgment. And again, some of it might sound harsh. These kids have to get off devices. Addiction is addiction, whether it is electronics or sex, drugs, rock and roll. You have to take that away. They're getting their dopamine from these devices. The only reason that they quote behave better and they do better is because they're getting such a dopamine rush while they're on it. They're completely zombied out and locked in. So they need to. We need to have the children off. Parents need to kind of go back and think about good old fashioned American family days and go outside for walks, go outside and play, sit around a living room without any electronics going. It is actually liberating after you do it for a while. Something I can't believe I have to even use this term, a deviceless dinner. Like I have my phone here to watch the time because I got to get back to the office in 15 minutes. But normally I'm going to keep this away from me. There should be no devices near the dinner table. Dinner time is social time. It is time to catch up on what is going on in your child's life, special needs or not. And open-ended questions like, "How was your day?" That doesn't go anywhere. Hey, little Johnny, how was that math test today? Didn't go well? Hey, bust it out right here. Let's go over it right now. Like, yeah, let's look at it. Let me see that. And yeah, I don't care if the broccoli gets on it. I want to see your math test. Let's talk about it. Let's figure it out. Make dinner time, social time. Devices need to go. Our local school district in Lee Summit is talking about the board. Some rumor, maybe Nick would know more about having no phones at schools. I will get up there in front of anyone and say yes, and you're gonna see kids go through
100%.
withdrawal. You'll see kids go through withdrawal, but after that, you will see if they want to be motivated for test scores and federal funding. You will see scores go up 100%. It'll be
I'm
unbelievable.
100.
And you'll see drug usage go down. By the way, the number one place to get drugs is Snapchat.
Yes. And also, too, kids are, our generation that was in school 20, 30 years ago. Okay, great. You were bullied at school. Crap, it sucks, right? But now the bullying never ends because now you're on social media, Snapchat, Instagram, and the bullying is relentless and it's around the clock, right? And so I
Yeah.
agree. There should be zero technology. Phones shouldn't even be able to be brought into school. Zero. I
Yeah.
fully support that.
Yep.
In my home, we have very little technology time, maybe 30 minutes, an hour a week. And
Yep.
my kids have to earn it. So it's left brain, right brain exercise, right? So it's left brain, go play baseball, go play catch, go run around. Right brain, go build your magnet tiles up, go play some music, go create something, right? So we're trying to think about things to get both sides of the brain in there and not rely on a screen to overstimulate them and bathe their neurons in dopamine. So I think that's important that go with the foundational things first, right? It's like old foods don't cause new disease. Well,
Yeah.
old exercises are good for the brain, right?
Yeah.
Legos, go for a walk, go throw the ball around, hide and seek, cops and robbers, right? Keep it simple, keep it old school.
Yeah. Yeah. It goes a long way. Absolutely.
Yeah, cool. And I think that's so important on the school stuff. I think that is so important. And kids do not realize, parents do not realize, the people that created these devices in Silicon Valley do not let their kids use it. Just remember that. Or if you do, it's like 95 fine, right? It's a very small percent of the time and try to use it for more beneficial type of means. Anything else, Dr. Alex, you want to leave us with?
I'm kind of tapped at the moment. I'm blessed to say we're busy with this stuff every day. I got to get back, drive down the road so I can get to a patient in about 12 minutes. But this
Great.
has been great.
So if someone wants to get a hold of you, how does that work?
You can go to the website, hmlfunctionalcare.com. You can find us on Facebook and Instagram. We post mainly educational things there. You can find myself, Dr. I think _ Alex Nelson on Instagram. You won't see much brain stuff there, honestly. You'll see more personal things that are posted. But hmlfunctionalcare.com, you can find us all there and what we're all about. People can come in for consultations to get to know us and see if it's a fit or not. And
Great.
then
We'll put the link
also,
down below. So if you guys,
oh, I was about to say also our podcast. We'll have to have you on mine, the Dr. Alex show.
the Dr. Alex Show. Awesome. Well, very cool. We'll put the link down below. If you guys are driving or you're walking and you can't quite get to your computer, look at the description below. We'll pin a comment as well to get a hold of Dr. Alex. And Dr. Alex sees patients in person in the Kansas City, Lee Summit area, as well as worldwide, telemedicine-wise, if you don't have someone in your area. So, Dr. Alex, it was a pleasure having you on the podcast. I appreciate all the knowledge you dropped, and people are listening. You know, if you can benefit, share with one family member or friend. Try to take one action point and try to apply it to you and your kids' lives. Thanks so much, Dr. Alex. Appreciate it.
Thank you.